Nociceptive pain is pain caused by physical or chemical damage, heat, injury, inflammation, etc. The pain signal travels to the brain using nerve fibers. Receptors, like transient receptor potential vanilloid or TRPV, get activated. Calcium enters, sodium channels open, pain signal begins. A. The fibers carry fast, sharp pain, like a pinprick. C. Fibers carry slow, dull, throbbing pain, like a burn. Pain processing has 4 steps. 1. Transduction, when the pain signal is created, blocked by local anesthetics, A2 agonists, gabapentinoids, NSAIDs, acetaminophen, steroids. 2. Transmission, when the signal travels to the spinal cord, blocked by local anesthetics, A2 agonists, opioids. 3. Modulation, when the spinal cord controls the signal going to the brain, blocked by TCAs, SSRIs, SNRIs, gabapentinoids. 4. Perception, when the brain becomes aware of pain, blocked by alpha-2 agonists, opioids, TCAs, SSRIs, SNRIs. USMLE Question 1. Which type of nerve fiber is responsible for transmitting slow, dull, chronic pain? A. Beta fibers. B. APHA fibers. C. ATHA fibers. D. C fibers. E. B fibers. Correct answer D. C fibers. Explanation: C fibers slow, dull, throbbing pain and are unmyelinated, making the transmission slower. Why not the others? A. Beta fibers carry touch and pressure, not pain. B. A fibers carry motor signals. C. AD fibers carry fast, sharp pain. E. B fibers are involved in autonomic preganglionic fibers. USMLE Question 2. Which of the following medications is most likely to reduce pain by inhibiting the perception phase of nociceptive transmission? A. Ibuprofen. B. Lidocaine. C. Duloxetine. D. Acetaminophen. E. Gabapentin. Correct answer? C. Explanation: Duloxetine is an SNRI, serotonin norepinephrine reuptake inhibitor, that blocks perception and modulation of pain in the brain and spinal cord. Why not the others? A. Ibuprofen blocks transduction. B. Lidocaine blocks transduction and transmission. D. Acetaminophen blocks transduction. E. Gabapentin mainly affects transduction and modulation. USMLE Question 3. Which of the following best describes the mechanism by which TRPV receptors contribute to pain? A. Promote GABA release. B. Block serotonin receptors. C. Cause calcium influx that activates sodium channels. D. Directly inhibit substance P. E. Open potassium channels to reduce depolarization. C. Cause calcium influx that activates sodium channels. Explanation: TRPV receptors, when activated by heat or injury, allow calcium to enter, which then triggers sodium channels and begins the pain signal. Why not the others? A. GABA is inhibitory, unrelated here. B. Serotonin is not blocked by TRPV. D. Substance P is involved in pain but not directly by TRPV. E. Potassium channels are not the primary mechanism here. USMLE Question 4. Which of the following agents acts at both the transmission and perception stages of pain processing? B. AFN2 agonists. C. Gabapentin. D. SSRIs. E. TCAs. Correct answer: B. Alpha-2 agonists. Explanation: Alpha-2 agonists like clonidine affect transmission in the spinal cord and perception in the brain, making them useful for pain control. Why not the others? A. NS act only on transduction. C. Gabapentin acts on transduction and modulation. D. SSRIs act on modulation and perception. E. TCAs act on modulation and perception. USMLE Question 5. A patient with chronic pain is started on a drug that works by increasing both serotonin and norepinephrine levels in the CNS. What stage of pain processing is most directly affected? A. Transduction. B. Transmission. C. Modulation. D. Perception. E. All stages equally. Correct answer: C. Modulation. Explanation: Increasing serotonin and norepinephrine enhances modulation, which means altering pain signal intensity at the spinal level. Why not the others? A. Transduction is at the site of injury. B. Transmission involves signal travel along neurons. D. Perception is higher level brain awareness. E. These drugs don't act on all stages equally.